Ozempic, Wegovy, Mounjaro. In a few years, these drugs changed obesity medicine more than the last 50 years. Most people taking them do not understand how they work, the real differences, or what is not said about muscle loss. In the next few minutes, we cover all of it. GLP-1 stands for glucagon-like peptide 1. Your gut releases it after you eat. It tells the pancreas to release insulin. It signals your brain that you are full. It slows stomach emptying. GLP-1 receptor agonist drugs mimic the hormone. They act stronger and last longer than natural GLP-1. The result is a prolonged signal to the pancreas and brain. The result is a major drop in appetite and significant weight loss. Clinical trials report 15 to 22% body weight loss. Researchers are mapping metabolic improvements that follow. These drugs improve insulin response and alter metabolism. Effects include lower appetite and slower gastric emptying. Ongoing research will define additional benefits. If you consider treatment talk with a health professional, they will review benefits and risks and guide next steps. Not all GLP-1 drugs are the same. Semaglutide, sold as Ozempic and Wegovy, is a GLP-1 agonist and yields about 15% weight loss. It comes as an injection and an oral pill. Tirzepatide, sold as Mounjaro and Zepbound, targets GLP-1 and GIP together and showed about 22% weight loss in trials. Survodutide is an investigational drug combining GLP-1 with glucagon. Early trial data may outperform the others. This field moves quickly, and these differences matter for what you should ask your doctor. Bring notes and ask about effects, delivery, and trial results. Let's clear up two big myths. Myth 1. These are quick fixes you take for a few months and stop. Fact. Research shows most people regain significant weight within 1 to 2 years of stopping. These are chronic disease medications similar to blood pressure medicine. Myth 2. The only effect is weight loss. Fact. Emerging research links semaglutide to fewer migraines, lower blood pressure, and a possible reduction in Alzheimer's risk. These effects go beyond original weight studies. Here is what does not get talked about enough. Both semaglutide and tirzepatide cause muscle loss along with fat loss. New research is comparing how much. The biggest mistake is not prioritizing protein and resistance exercise. If you use these drugs, treat strength training and protein as part of treatment. Protein protects muscle. Aim to include protein at each meal. Pair protein with resistance exercise to preserve strength while losing weight. Prioritize progressive resistance. Start with 2 sessions per week and increase as you progress. Track your lifts and focus on form to protect muscle. Aim for 1.2 to 2.0 grams of protein per kilogram body weight depending on activity. Combine with regular resistance exercise for best results. If you are on or considering these medications, treat strength training and protein as part of care. Talk to your provider about a plan that includes both.
Quick answers to common questions. Are these drugs safe long-term? Long-term data is growing. The SELECT trial showed cardiovascular safety for semaglutide over 4+ years. Monitoring continues for rare risks like pancreatitis. Are these drugs available in India? Yes, semaglutide is CDSCO approved. Access and cost vary by clinic and region. Talk to an endocrinologist to review options. If you want natural support for the same pathway, eggs, oats, berberine, and whey protein all trigger GLP-1. If you printio Chi1, please to a modest degree. These are not a substitute for prescription treatment.
So here is the bottom line. These drugs work genuinely well, but they are not a switch you flip and forget. Understand which drug does what, protect your muscle while you lose fat, and go in knowing this is a long-term commitment, not a quick fix. We have put the complete guide, every comparison, every study, every FAQ at Medimadad.com. Link is right there on screen. Go check it out.